I'm just here to talk about the world that we work in the community, and that being dealing with the fact that people do end up on oxygen sometimes with COPD. Keep up your rehab. Those of you who don't need oxygen now, work hard on that part and stay well. But sometimes oxygen is needed, and how do we have a lifestyle still with oxygen therapy? But how do I get home oxygen therapy? How is it decided I need it? Who pays for it? And the real focus will be that dreaded pill. You know, blood pressure medication's easy. You take your pills, but now we've got to deal with the medication comes in equipment form, and it's not something you can slip in your shirt pocket. So we'll talk about that, a bit about equipment, and the teamwork related to doing that well. So needing it, you need to have a medical need. Like any other medication, you need a medical need. Medical oxygen is a drug and requires a prescription from your doctor. And either your doctor, one of your care team members, or yourself will then refer to a home oxygen provider. The criteria, and I'm not going to get into this, but the criteria is established. It was established with some scientific studies, and Dr. Chapman has written an excellent article in the newsletter this issue. And there is evidence that when you need it, when you meet those medical criteria, there is benefit from oxygen therapy. How is it funded? This is an important question. Many people who need oxygen are on fixed incomes or seniors. How is oxygen funded? You need a valid Ontario health card. When that medical criteria is met and you have a valid prescription from an Ontario physician, then the Ministry of Health does fund 100% if you're 65 or older, and 75% for those less than 65, unless there's some special circumstances there, but for the most part. And often private insurance will pick up that other 25% portion. That dreaded pill, the equipment. Quality care still improves quality of life, and even when you have to add that equipment into it. So I encourage you, and that's been a theme throughout the day, to be actively involved in your care, to speak up. Sometimes it's hard. You feel vulnerable. You feel that you're the one kind of having to take whatever is given to you. But I do encourage you to speak up. What was your life like before you had oxygen therapy? What is important to you in living your life with oxygen? You know, do you travel south every winter? Do you visit family and you like to be able to do that when you want to do it? And then your community oxygen provider can work with you to get your supply and the type of equipment, what system you use to fit with your medical and lifestyle needs. Safety first. There are safety rules around oxygen. If you smoke, don't smoke when you're wearing it. If you smoke, please try to quit, but don't smoke when you're wearing it. The main thing is that oxygen is what makes a fire burn. So if you add flame to oxygen, if you have risk of that, then you have potential for a lot of trouble. And then there's the things that are flammable. I won't get into the details. All of that comes with setting up oxygen at home. These are the stationary concentrators, and I just brought some pictures, and I know the screen makes it a little fuzzy, but I'm not going to get into tons of detail here on equipment, but this is a system often set up in the home to produce oxygen just for that home environment. You still have to wear your nose piece, but it's the stationary system, and it takes oxygen from the air, which is 21%, concentrates it, and delivers it to you. And you can get flow rates from 1/2 liter a minute to 10 liters a minute with a concentrator. It's very simple, and any of you who use oxygen therapy can attest to the fact that overall the equipment is set up to be pretty simple to use, and it's safe to use. And they're getting them smaller, even the stationary systems for the home, they are making them smaller as time goes along. Some of the challenges with a concentrator is it does need electricity, and it has some limitations, although that has changed somewhat with the improved version to 10 liters. And equipment fails. That is reality. You need to use preventative maintenance, and your provider needs to do that. But even with the best of care and attention, equipment, that's the risk with equipment. Oxygen cylinders often are a complementary portability device, and the larger one over here to the right is often used as a backup supply to that concentrator in the event of a power failure. They have their place in therapy. They're not pretty. None of the equipment really is pretty, though, or very attractive. They're getting a little bit better, but they're good for a small volume user. You don't lose oxygen. There's no waste with them. You can store them indefinitely, and they can be good for portability for certain situations. And then there is conserving devices, and there's a bunch of pictures here of technology that delivers flow on inspiration only. And you can hear one of our ladies has a system that is doing that, and you can hear the ch, 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 because every time she breathes in, she's getting a burst of oxygen. It does change because you breathe in a shorter time frame than you exhale, and what it's doing is it's delivering the oxygen when you breathe in, and as soon as you stop breathing in, it's actually stopping the flow of oxygen, so you're not wasting it while you exhale. And as we've heard already today, exhalation is a longer time frame than inspiration, so you're actually extending the that oxygen supply. It's really important. It's important with all technology to make sure it's going to work for you and do what you need clinically. It's also, with this kind of device, it's just really important to have a full assessment done and make sure that what was prescribed for you is happening with the device. So I've talked about the benefits. I think they are lightweight. The devices are lightweight. They're convenient. The fact that it only delivers on inspiration, it's not irritating your sinuses all the time. So that does some people that bothers more than others. And you say you conserve the oxygen. Again, it's equipment, and there is reliability issues. It's important to assess clinically. And the setting on that conserving device, no matter what kind of conserving technology you use, doesn't always correlate to your prescription. It needs to correlate clinically to effectiveness. Portable concentrators, and there's a few of them up here. One of the ladies has one. I haven't checked out everybody's equipment here, but this is a newer technology on the marketplace. They're a smaller, lighter weight system. Still, any of you who have oxygen therapy know that no matter what the weight is, carrying around or even pulling around your oxygen is added work, is tiring, is all of those things. So lightweight is a little bit, 5 pounds might not be heavy for me, and it might be something that you find very heavy. They are reasonably versatile. They have a battery that they'll operate from, needs to be recharged, but that can be done either in your car through your DC or AC in the house. You have to tolerate the conserving technology, but a lot of people do. It is convenient, and convenient especially with car travel and the option of running with the DC charger. They have some challenges still, and technology always has challenges, but there are challenges. It's reasonably new on the marketplace. There are some issues with reliability, and it is important if you are assuming that your oxygen is going to work when you leave the home, you want to know that that is the case and that it does do what it needs to do for you. As you are active, and Moran talked to this some, as you are active, your demand and your need for oxygen increases. And the smaller you get, the less reservoir, the less storage space you have in these units, and thus that supply and demand curve can get a little out of whack, and you may need more oxygen than is available to you. And that's part of what is so important in that clinical assessment. You do need to charge the batteries, and you need to take responsibility there. But as all of you know, when you have oxygen therapy, there's a lot of planning. There's a lot of preparation for just the simple things that you used to do without thinking. You have to be prepared and have your supply. And again, a clinical assessment, I can't stress it enough. It isn't just about delivering the equipment and you having what you like because it looks right, and I don't minimize that. Listen, that's important to all of us, but it really is about, does it work for you and does it do what it needs to do? Because my gosh, it's not fun wearing oxygen anyway. Why would you want to wear it if it's not even doing what it needs to do for you, right? Another system is liquid oxygen. I know Mary has a liquid oxygen portable here. It is another way to get oxygen therapy. There's a significant supply because the oxygen is actually stored in the container in liquid form, and that conversion to gas it produces 860 liters of gaseous oxygen for 1 liter of liquid. So that's a huge amount of oxygen you can carry in a small space. You do have independence. You can fill your portable from the base unit. The base unit can be used as a main system, and it doesn't require any kind of power. So that's a nice piece too. Just know that, again, it's very simple technology and easy to use. Now you can see actually filling a portable from the liquid base unit. And it's quite a simple technique. It gives you that kind of independence where you have a supply there and you can fill it up, go shopping in the morning, come home and have a little rest and decide you're going to go and see your daughter and go out for dinner in the evening, fill up your portable again. There's a nice independence that way. One of the key things is just the safety around it. That fact that it's liquid oxygen and converting to a gas all the time does create some risks around frostbite. The other piece with that really is with humid weather, it's transfilling, and when there's risks of it just freezing on and some of the hassles of that. When you know what you're doing and take your time, usually you can manage most of that pretty carefully. So in conclusion, I started working, I won't tell you when I started working as a therapist, but when I did start, oxygen in the home was big K-size cylinders. And you had a few of them and you were pretty careful how you used it, and it doesn't last very long. Equipment's come a long way. And as a respiratory therapist, equipment is a huge part of what we do all the time. The therapy part is absolutely essential, but we don't do almost anything without the equipment aspect of it. It has come a long way. It is very user-friendly. Important that you understand its safety and how to use it. And just always remember that the best equipment application really depends on you, your prescription, and what your lifestyle is. So in summary, clinical effectiveness with the therapy is absolutely paramount. Portability is essential, and you deserve portability if you're out and about, good portability. And clinical effectiveness of that portable system is an absolute must. Know what you should expect. You need to be assessed. There needs to be someone working in healthcare come in and assess your oxygen levels in your home, do your daily living with you, and see what oxygen, make sure that that system is meeting your needs. And that individual working with you needs to have the knowledge and offer the technologies and the systems that are available to you. It is a team, and we're here with you. It's a teamwork with your oxygen providers, healthcare professionals, the care team that's involved in your care, and you to get the best clinical benefits from your oxygen therapy. It's your health. We're here to help you. Thank you very much. The question is, the government funds a system. What happens if you want a system to go out and about with and a system at home? The way the government set it up, and it's consistent for everybody who provides oxygen out there, is they fund for what a reasonable need, and that includes portability. So if you have a system at home and you want some portable adjunct to go out, that all should be funded. If you want a system at home and you want a system at your cottage, then your provider can work with you there, on what is the easiest way. But you should get your portability as all part of the package.